I will present our data focus on Daratumumab treatment in multiple myeloma patients. And this is, we call it the DART for myeloma protocol. It's a multi-center Italian center in which, and is co-financed by Janssen, and in which we use Daratumumab in a setting of multiple myeloma patients already more than very good partial remission. And the scopus, the aim of the study was really to try to give myeloma patient already with a good response to give a little bit of efficacy more than that to obtain MRD negativity. So prerequisite in this study is that CR is already has been already shown to be a prerequisite for progression-free survival and overall survival. And all myeloma patients eventually will relapse, and we'll see that later with Claudio. But consolidation has been shown in the past to increase responses, and now that we had a very good drug such as Daratumumab, we can give MRD negativity to patients already achieving a very good partial response. And we measure MRD by next generation flow, already set as one of the possible technique to measure minimal residual disease together with NGS. And these are the International Myeloma Working Group criteria. Basically, all the antigens that are seen on the plasma cell and the tube that are using those antibodies are reported here. And of course, CD38 and CD138 together with kappa lambda, but also CD56, CD28. This is the Aeroflow commitment that has determined how to measure NGF. We've been interested in next generation flow with Donatella Raspadori and Paola Pacelli. Already, it has been already 5 to 6 years. And this is briefly the schema of the DART for myeloma. So here we give the DART, which is Daratumumab, weekly for 8 weeks, and then every 2 weeks for another 8 weeks. And we said multiple myeloma patient already in more than VGPR, but MRD positive entered the study. NGF was positive in all the patients, and MRD was positive. We also did PET-CT, which is crucial to measure disease outside the bone marrow, because myeloma, it's known to have a patchy disease. And then we measure NGF at 2 months, but this is not a primary endpoint. Primary endpoint was NGF at 6 months. If the patient had an MRD negativity after 6 months, they stopped therapy and were followed at every 6 months until 2 years by NGF. If the patient were MRD positive after 6 months, they received monthly Daratumumab up to 2 years. So the good of this study is that we started almost 3 years ago. And the good of this study, I think, with all the studies that are now measuring MRD with NGS and NGF, is that we have a long follow-up. And we saw very interesting results. We started with Daratumumab rapid infusions, but now we are doing Daratumumab as always subcutaneously. So this is the study period. As I said, almost 3 years ago, we started. We screened 110 patients for MRD by NGF. 53 out of 110 patients, basically after auto transplant, resulted MRD positive. We enrolled 50 patients. That was the endpoint of the study. And as you see, all the center involved in the study. Siena was center for the analysis of minimal residual disease by NGF. That means that we received the sample from all the centers, from Florence, Pisa, Ascoli, and Terni. And these are the patient characteristics. So as you can see, most of the patients received one autotransplant or two autotransplant, but there were also patients that received a VMP or KRD, one patient. Basically, these are the results. In green is highlighted the endpoint. The endpoint is 6 months. At 6 months, we already analyzed all the 50 patients, and this is basically confirmed. A third of the patient after 6 months achieved MRD negativity, which is, I think, a good result. Daratumumab was given, as I said, monotherapy. So in a selected population of multiple myeloma patients with already a very good partial remission or a CR, MRD positive, patients that they basically maintained their MRD negativity until 2 years, and someone up to 2 years. We had 6 progression disease, and you can see here basically the characteristic. We tried to look at the MRD negativity at 10 to minus 6, which means to have very good sample to analyze. We tried to do our best, but with Donatella Raspadori and Paola Pacelli, we tried to reach as many cells as you can see. Try to compare the MRD negative results to also NGS possibly. We had 6 progression disease. You can see that here the characteristic of the patient. 2 patients that progressed at the 414 translocation, and 1 patient progressed during Daratumumab, 1 patient progressed at 30 months, and 1 patient progressed with an extramedullary disease, and this is very interesting, but keep maintaining MRD negativity in the bone marrow. And as you can see here in this slide, you can see the red dots. Red dots are MRD positive status. At the beginning, these are the not transplanted patient. MRD negative patient are the green dot. So patient that received basically VMP all had an MRD positive result except for 1 determination, and 1 already progressed. Patient that received 2 autotransplant had so far the best results. There are patients that achieved MRD negativity at 2 months, and they keep maintaining MRD negativity more than 24 months after Daratumumab. And these are the main population of the patient that received 1 autotransplant, and you can see the green dots. And also in this population, we have some patients that achieve MRD negativity at 2 months and keep maintaining MRD negativity at more than 24 months. Basically, 40 patients out of 171 determination were MRD negative, and 5 out of 47 relapsed. And we have also progression disease after 1 autotransplant. And basically, we had the more the better results with the double autotransplanted patient, and this makes sense in the fact that probably 2 autotransplant are more eradicating than 1 autotransplant. Looking at cytogenetics, you can see that isotogenetic patient had 3 out of 7 deletion 17, 2 out of 7 at translocation 414, and the 1 was defined as a double hit myeloma, 1 was defined as a triple hit myeloma. And in this setting, 3 out of 7 patients relapsed, which means 43% of the patient. If we look at standard risk patients, that means patients that didn't have high risk cytogenetics, you can see that in this case, only 3 out of 34 patients, 9% of the patient relapsed. And also this makes sense, but was to be determined in this study. Another thing that is very, very interesting, and these are data from the PhD thesis of Paola Pacelli, and this is the total plasma cells during treatment with daratumumab in the MRD positive patients. That means patients that are 6 months keep maintaining MRD positivity. The daratumumab keep functioning until 6 months. Here we stop daratumumab. You can see total plasma cells are keeping increasing. But if you see wild type versus clonal plasma cells, you can see that interestingly, clonal plasma cells are still low. And so there is a kind of immunogenic effect, seems, of daratumumab that keeps maintaining low the clonal plasma cell versus the wild type. So this is, I think, a very interesting point that has to be expanded and studied more. And with this, I can stop my presentation.